What has been the success rate with dental implants?
Success is there. There's no question that it was always in the 80 to 90% range. I think our success rate exceeds the 90+% range now on a regular basis. Imagine that you're missing a tooth in a very aesthetic part of your mouth, and now you have virtually a space. Well, nobody wants to live with those spaces, certainly if it affects their smile and aesthetics. So from that perspective, the most appropriate thing would be to replace it. If you replaced it with a removable appliance, you still have the concern of chewing with it. It moves a little bit. It's a little uncomfortable. It could abrade the gum tissues underneath it because it has to, straddle part of your palate, for example, to stay in place. But today, if you just had the individual tooth root replaced with a prosthetic implant root, and now you built a crown on it, and it looked as natural and as normal as the rest of your teeth, and it blended in perfectly. You don't even think about how you function in public or privately, or when you're chewing, or when you're just smiling. It's just a very much more natural thing. Well, that's for a young patient. Let's take an older patient. Let's take a middle-aged patient or an elderly patient. Just imagine using a removable appliance because you're missing a few teeth. So as you get older, and we're talking about going from your 50s to your 60s to your 80s and beyond, what happens is your tissues in general, the gum tissue starts to thin, just like your skin tissue thins. And what ends up happening is you're much more sensitive to little abrasions and little sorenesses that can develop. Well, if you have a removable appliance, that's something that you take in and out of your mouth that's resting on these soft tissues, and it moves a little bit, it causes all kinds of discomforts. Patients don't feel as comfortable eating and chewing. Forgetting about aesthetics now, you just have the discomfort on a daily basis of not being able to enjoy the benefits of just a good meal. To be able today to replace this removable appliance with an appliance that is fixed and rigidly connected to underlying implants creates a stability and an ability to function normally that you haven't had. This is our goal today. We have to think about how we can provide patients with comfort and function well into their late 80s and 90s today. And so implants have been a game changer for patients. And success, that's the kind of success that we're looking for.